thanks for joining me. Today we're talking about these jowls here that happen usually when we're about 40 or 50. First off, let's talk about the causes. Before I get into the root causes, I want you to imagine a balloon. And then on top of the balloon is your skin. And basically imagine that balloon deflating. Well, as it deflates, the skin's got to go somewhere. It's not just going to be held up here, so it's going to usually sag, right? Well, imagine that in addition to losing elastin and collagen. And those are the important structures that give your skin that bounce and stretchiness, really. You end up losing fat, usually here in your temple. Take a peek in the mirror. If you're 40 or 50 and you're seeing a large hollowing here, that should be restored. It's your first stage of correction. Second, we need to restore volume in your medial and lateral cheek. And you can do a simple test here. Actually take your two fingers here and here and pull up slightly. And if you want, put your finger here to feel the resistance. If you're pulling up and you feel a little tug here, or if you see your jowl kind of go up, then you're going to notice an improvement simply by addressing these two factors. Next causes, we have these two major ligaments. It's called the masseteric cutaneous ligament and your mandibular cutaneous ligament. And these start pulling down when we start hitting the age of about 40. And then third, basically we have bone reabsorption. So our bones start shrinking a little bit as we hit about the age of 40 to 50. And then finally we have genetic and environmental factors that have a role on what happens with our elastin and collagen. Now that you guys know a little bit about the anatomy and the causes, what do we have to do in order to treat these things? There's facelift, there's cool sculpting, there's a whole bunch of other factors, but today I'm just going to focus on Botox and fillers. We're going to start from the top. If you notice that you have this hollowing, fill here, restore that volume, it's going to pull up a little bit. Next thing we have to do is look at the face here and here. If we see that there's volume loss here, just restore it back to its natural position, and that's also going to help address that. Then what I'll do is I'll restore any lost volume here, further pulling on the skin. So imagine you're having pull here, pull here, pull here, and pull here. That's really going to give you this nice little lift. Now the next thing that I'll do is when I'm restoring this volume loss here with the cannula, what I'll do is I'll actually take my cannula and I'll go in and out, and I'm going to start releasing that mandibular cutaneous ligament that's pulling down, and it'll help restore that natural position. Furthermore, what I'll do is I'll connect the chin to the jowl with a firmer filler, giving you a nice angular line to your chin. And I'll do the same thing with the jaw. Usually when we hit about 40, this angle stops becoming an L and it ends up sliding, kind of doing this. So we restore the volume and we connect it to that little jaw that's there, and those two techniques do a pretty good job, particularly if you're using it with the other techniques. Now the last trick that you can do is your masseteric ligament that pulls down here. Take a look at your jowls. If you have jowls, a lot of people, what they notice is that there's actually a hollowing right here. So what you can do is that you can give that masseteric cutaneous ligament some structure by giving it some good lifting filler. Finally, what I do is I look at the neck. If I see these bands at rest, these bands there, if I see those at rest, then I know they're pulling down. So imagine you have these bands. As we get about 40 or 50, what they do is they start pulling down on the face right here. So if we can relax those with Botox, look, you can see it kind of springs back. Relaxing those will help the jowl as well. Remember, I'm just giving you options here. I'm not saying to get all this done. I'm just saying take a look at your face, look at what you could benefit from, and maybe it's just to connect this jawline here and here. Maybe it's just to relax this band. Maybe it's just to restore some lost volume here. I'm a big believer in restoring that natural volume that was lost, keeping it natural, and preventing you from having to go under the knife, because there's always a lot of risk with that. Hey guys, that's it for today. Thanks so much for tuning in. This video, by the way, was the result of one of the viewers who've made a recommendation, a comment. So please feel free, make more comments, post suggestions. I'll be happy to answer any of your questions. I'm Phil, me and Dan. This is my journey to the mastery of Botox and fillers. Take care.